Child maltreatment. What is child maltreatment? Child maltreatment is defined as abuse or neglect that occurs in children under 18 years of age. This would entail causing emotional or physical harm. Four types of child maltreatment we will cover that are widely recognized is physical abuse, psychological abuse, sexual abuse, and child neglect. About how many children are affected. The national estimate of total CPS agency referrals for 2018 is 4.3 million at a rate of 58.5 per 1,000 children in the population. This is an increase from 16.4% from 2014. Our statistics differential in POC, people of color. Most victims are one of three races or ethnicities: white, Hispanic, African American. We were very shocked to know that white people took up the majority of the child maltreatment statistics. But as we studied further the social underlying problem, we weren't surprised, as white people are higher in poverty. Which brings us to our next subject. What is the social problem underlying the issue? Children in low socioeconomic households are 3 times more likely to be abused and 7 times more likely to be neglected. Lower income communities have higher trends of drug and alcohol abuse with little to no resources to help combat this, contributing to this cycle of being an unfit parent. The trends of poverty associated with child maltreatment, but very little research has been done to research this correlation, resulting in the underlying issue to be ignored, thus very little progress made towards policies, systematic changes, and overall possible solutions. As well as not all child maltreatment being reported, leaving countless children at risk, professionals accounted for 67.3% of child maltreatment reportings in 2018. How serious is it? The most vulnerable are the most susceptible. The youngest children are most likely to be victims of child maltreatment. Nationally, more than a quarter of children, 28.7%, are younger than 3 years old. The victim rate is higher for children less than 1 year old at 15.3%. So the problem is also not getting better. From 2016 to 2018, there's an overall increase in the number of victims reported with the alcohol and drug abuse caregiver risk factor. So the percentage of alcohol abuse caregivers rose from 11.6% to 12.3%, and the percentage of drug abuse caregivers rose from 28.9% to 30.7%. We also studied the long-term effects of child maltreatment. Maltreatment has the capacity to disrupt healthy development during adolescence and early adulthood and puts the individual that's affected at risk for economic difficulties later in life. In a sample study from 496 parents from New York that had suffered a lot of economic financial stress from 1988 to 2016, the study found that participants who reported child maltreatment when they were a child reported significantly greater depressive symptoms and substance abuse during their adolescence.
Today we'll be talking about CAPTA, the Child Abuse Prevention and Treatment Act. It was originally enacted in 1974 as an amendment to the Social Security Act. What it does is provide a definition on what is considered child abuse and neglect, requiring states to have mandated reporting laws in order to receive grants and funding. These states have to create statutory language on defining what child abuse and neglect is, while providing support and guidance to states that support prevention, assessment, and investigation of child abuse. This act has been amended and reauthorized over the years. The most recent amendment was in 2018 by the Victims of Child Abuse Act Reauthorization Act of 2018, which provides immunity from civil and criminal liability for people who report child abuse and neglect or provide information and assistance in good faith. These include medical consultations and evaluations. The forms of funding that I focus on are state grants, which is funding that goes to states or territories that help improve their child protective service systems. All the states have to do is comply with various requirements related to reporting, investigation, and treatment of child maltreatment cases. to receive the funds, the states have to provide that it has procedures and policies in place to receive and respond to child abuse allegations and ensure the safety of these children and provide appropriate referrals. Another form of funding is the community-based grants, which is funding that goes to states and territories that support community-based activities and services that will help prevent child abuse and neglect. The funds are typically designated to a lead entity in each state. These entities have to provide directly or by referral core family resources and family support services. These services include parent education and slash or parent mutual support groups, community and social services referrals, voluntary home visiting, and respite care. This also can include public agencies or nonprofit organizations of Indian tribes or tribal organizations. Another form of funding is the Children's Justice Act grants. This is funding that is available to states who are improving their areas of investigation, prosecution, and way of handling child abuse cases, especially focusing on cases of child sexual abuse and exploitation. For states to receive these funds, they have to establish a multidisciplinary task force to study state administrative, judicial, and investigative practice related to child abuse and neglected cases. Another form of funding is for research, demonstration, and technical assistances. It is awarded competitively to programs that support an ongoing research to better help in identifying, preventing, and treating child abuse and neglect. It also requires federal efforts to collect and pass on child abuse and neglect data, operate an information clearing warehouse, and provide technical assistance related to child abuse and neglect, prevention, and treatment. Now, who does this help? As defined by CAPTA, any recent act or failure to act on the part of a parent or caretaker, which can result in death, serious physical or emotional harm, sexual abuse or exploitation, or an act or failure to act which presents an immediate risk of serious harm. This is a basic definition established by CAPTA, but all states do have to create their own definition of child abuse and neglect, as long as it is similar to that of CAPTA's. What it does is that this helps protect children that are under the age of 18 or for those involved in cases of sexual abuse. This definition was also expanded to help children who are victims of sex trafficking. From what they found, these states are reporting higher rates of child abuse and neglect among young children and children who are African American, American Indian, Alaskan Native, or of being two or more races.
Prevent Child Abuse America is a national program whose goal is to promote healthy child development and prevent abuse before it occurs. They offer direct support services and advocate for funding and family-centered policies to reduce contributing factors to child abuse and neglect at the state and federal levels. One of their programs, Healthy Families America, uses the strengths perspective to build relationships with families and refer them to resources, including home visits and community support. At the federal level, PCA America urges the government to support increased funding for CAPTA and child sexual abuse prevention programs, and the Family First Prevention Services Act, which focuses on placing children in family foster homes rather than group homes. At the state and local level, PCA America pushes for policies that include financial support through family-friendly workplace policies, including paid family leave and livable wages, subsidized childcare, and state earned income tax credits. PCA focuses on these financial support policies because paid leave is associated with reductions in hospitalizations for abusive head trauma and lower rates of family stress. Studies also show that paid leave improves worker retention, as mothers are more likely to return to their jobs than those without paid leave. States with higher funding for child care subsidies report decreased rates of child abuse and neglect. When parents have financial assistance, they are able to choose better quality child care and are more likely to enter the workforce. States with refundable earned income tax credit report 13% fewer head trauma admissions and decreased parental stress. PCA America also advocates for more funding for home visiting programs. These programs provide information and connection to resources to new parents. Results include reduced rates of pregnancy complications and low birth rate, and decreased parenting stress. More funding may help with outreach and staffing. A possible hurdle may be gaining trust of families when it comes to allowing workers into their homes.
Advantages of CAPTA. One of the advantages of CAPTA is that it helps identify key risk factors for occurrence of child abuse and neglect. It also focuses on preventing and responding to child abuse and neglect while providing treatment for victims. Another advantage is it requires states to have procedures in place when dealing with allegations of abuse or neglect. It gives abused children and their family an opportunity to improve their situation while providing grants to public agencies and nonprofit organizations. Disadvantages of CAPTA. According to Youth Today's article published on August 31st, 2018, because of CAPTA wanting states to have reporting laws, there has not been evidence that they reduce child abuse. A gal or guardian ad litem must be involved in child welfare cases. However, they do not require this person to actually speak up for what the child wants, only for what the guardian thinks is best. This also institutionalized racial bias. Advantages of PCA America. One of the advantages of PCA America is it lays the groundwork to deliver the childhoods that children deserve, the good ones. It also increasing services to families, home visiting, early childhood education, and parent education. And it also provides mental health services to parents and neglected children and youth. A program they have is Healthy Families America program. This involves home visiting strategies that are proven to improve child well-being and reach over 100,000 families each year. Now another advantage of PCA America is it spreads awareness of child abuse prevention through Pinwheels for Prevention campaign. Partners with different organizations to better children and their family across the U.S. For example, they have a partnership with the Alliance for the Advancement of Infant Mental Health. The disadvantages of PCA America are Healthy Families America is not available in all 50 states. They are only located in 37 states. They also only help until the child is 5 years old. PCA America only has chapters in 47 states and Washington, D.C. While this is a good program, this program can potentially cause an abuser to become agitated because he or she may not feel like they need help and that they do not want other people in their business. For example, a social worker does a home visit because a teacher reported a bruise on a child, but they do not find anything. The abuser can become upset because someone was in their business and take it out on the child.